Etwapo, letting us know the actual situation on ground that is around the University Way roundabout. So do stay with us to get more updates on how the roads will be looking, especially if you are looking to get into the Central Business District area. So right now we get into the first discussion for the day, and as I had mentioned earlier on, today we're going to be having a conversation in regards to the forthcoming 25th edition of the World Remembrance Day, just looking at road accident victims, both who have succumbed to road accidents and those who have been affected in one way or the other, trying to see how we can make our roads safer, and more so during this season that we are going into as a country, in as much as we are smack in the middle of this pandemic. This season has always been occasioned by so many accidents, so many lives being lost on the roads. But what can we do to make sure that, we try and bring these numbers down, but looking at also how we can honor those who have gone ahead of us as a result of road accidents? To join us and helping us with this discussion this morning, we have Dr. Duncan Kibogong, who is the Deputy Director in charge of Safety Programs and Public Education at the NTSA. Karibu sana Daktari.
Asante sana.
Thank you for making time to be with us this morning.
Karibu.
Now, just starting with this, the 15th of November coming up this Sunday, before we get deeper into this discussion, why is this day important? Looking at a day where we get to honor those who have passed on and the victims of also road accidents who have survived.
Yes, thank you so much, Omboy. I think as you've just started, right, I'll continue from what you're saying. World Day of Remembrance of Road Traffic Victims is a global event.
Yes.
Commemorated and observed all across the globe, in different cities, in different areas, different communities across the globe. And it's a day set aside by the United Nations General Assembly, right from about now 15 years ago. The whole idea is to commemorate those who have died over that period of time,
yes,
and even those injured and those maimed, and as well work towards supporting programs touching on matters of safety, basically to bring it from the ground and make it an agenda on the table across other programs in government and in the private sector,
yes,
and in and across the community, so that it becomes an agenda of the day. I'll put it this way, that for your viewers, so that they understand the kind of the problem you have, or how big the problem is that globally you are talking about 1.35 million persons dying every year, annually, because of this problem. And this is continuously becoming a bigger problem. The irony about it is that this is a problem which is happening in low and middle income countries. It's worse off in low and middle income countries like ours, and yet we have low motorization levels. And like high income countries, they have high number of vehicles in the roads. Their paved roads network is a bit longer, bigger of course, but they have proportionately lower numbers compared to ourselves in Kenya and other countries. So we look forward to commemorating this day event. It's usually on the third Sunday every November, and it brings all the stakeholders, and as I said, it involves virtually everyone, because we've always said that this problem, either you've been affected by this problem, or you know someone who has been affected by it one or the other.
At one point or the other.
Yes.
And looking at the fact that most of these accidents and as a result deaths have been happening in low and middle income countries, what are some of those long-standing reasons that as an organization you have been seeing remain to be a problem in Kenya, and also could be a problem in other parts of the country, but what you have seen here in Kenya that have remained to be a problem year in, year out?
Yes, the major cause, or what is making road traffic injuries, or rather road traffic crashes to happen, the major problem is what we always classify as the human component. At times people call human error, but as we call it human component, the contribution from the human being itself, the road user. So this is a situation whereby it's largely behavioral in nature. When I say largely behavioral in nature, is because how you behave on the road really determines whether a crash happens or not, which involves you or involves another road road user or another vehicle. And much of, or majority of these are some of the areas, including, for example, drink driving,
yes,
drug driving, issues to do with speeding. Speeding is one of the biggest risk factor. Speed is largely determined by your behavior. If you choose to go to low speed, then your chance and probability of getting a crash is dramatically low. But if you go at high speeds, then definitely a crash happens. Issues to do with reckless driving, overtaking badly, and fatigue. Fatigue is also a human factor, because you know that quite clearly that you're tired and you still keep on driving.
To drive.
Then in that case, then definitely you are likely, your performance as a driver is going to diminish, including issues to do with not wearing a helmet. You know, when you're boarding border, which is not, for example, you don't put on a helmet, or the rider is not licensed, or actually not even undergone driver training or rider training to ride. So much of the things are largely behavioral, and we always talk about in excess of 85% of causation of road traffic crashes is behavioral in nature, because of the road user, whether you are a pedestrian, whether you are a driver, a passenger. Passengers not putting on a belt, in case of a crash, then it doesn't, you are likely to get injured, or probably even fatally injured. So that is it. We have a small contribution, not really small per se, but the other 15 or so is because of the vehicle, not maintaining your vehicle well. Even the fact that you don't maintain your vehicle well is also behavioral. It is your component. You know, your vehicle is not.
It's still linked to the human component.
And you still, yeah, it is. And then there's also the road network, the infrastructure, although does contribute. We reckon that there are areas which have been classified as hazardous, as sections or black spots, and those are some of the areas which government works towards also trying to improve on the same, working with different stakeholders within government and outside government. And
looking at the fact that there are black spots.
Yes.
And we have always heard of black spots. We even have classifieds that are run on media, and especially during this season, to just remind people that these areas are black spots. Why aren't we addressing the fact that they are actually black spots, to avoid having them being a causative agent of more of these cases? Yes,
I'll tell you, the fact that a place is a black spot, that is one, but it is also for a crash to happen is a factor of many things. It's also the fact of the human, the behavior of the person. It does not mean that all black spots will cause all type of crashes involving all road users in that particular case. What I'm trying to say, in other words, is you realize that a black spot is because at times the place has, all areas have a potential of being a black spot. It's only at times the areas which are more, should I say, more black spot than others. But indeed, the human component around playing around that particular black spot also matters. For example, if you know that a particular area is a black spot, why would you be driving at excessive speeds? And we posted limits that this is probably 30 kilometers zone or 50 kilometer zone, up to including warning you that you need to go slow and you don't need to overtake on this particular area. But you still find people overtaking. But that notwithstanding, government working with other road agencies or NTSA have worked towards improving some of this. One of the biggest areas which I am sure you'll probably mention is the Salga area, which has been identified in the recent past to be a stretch which is hazardous in nature. But you've realized that there's an improvement in terms of treatment of that particular black spot by separating lanes, whereby the upgoing and downgoing traffic do not in any way come in contact or do not collide in any way. In that case, you realize, and I think this is one thing, if you see our data in the recent past, there have been dramatic, significant reduction in the number of crashes around that particular area. But that notwithstanding, the fact that there's a treatment of a black spot does not give you a guarantee that nothing is going to happen, because, as I said before, black spot is road related, but 80 to 90% of the crashes do happen in other areas, including pedestrians crossing on the wrong points, despite the fact that there's a provision of infrastructure to ensure that you are safe. People drinking and walking, drinking and riding, people overloading. We've had in the recent past a motorcycle carrying about 4 persons, and they all get crashed, and they died, about 4 or 5 of them, in one of the areas here in I think central Kenya, something like that. So this is largely behavioral, because you cannot say that is because of a black spot, but you are already 5 in a motorcycle, riding on the wrong side of the road, drunk at night, with no reflector jackets, with no helmets, and you get crashed, and the 5 of you, or 4 or 5 of you die. That is tragic. But the story is, we need to tell Kenyans this should not happen. Largely speaking, road traffic crashes are preventable. Largely preventable, and you can do something about it, and that's why there have been significant improvements in some other areas, and in some other regions, and in some other countries, because things can be done and can be done. But for us as a government, we are instituting measures to ensure that we work towards reducing these road traffic crashes, so that as we commemorate this day, we know that there's a reduction of fatalities in the country, or if
as
not of a particular class.
Yes. Now, I want us to just talk a bit about this human component and look at the different aspects that come into play. And let's just start with the driver's training courses that we have here in our country. From where you sit, looking at the fact that, of course, before you get issued with your license, you have to go through a certain training courses, both theoretical and practical. But once you get your driver's license, you're set to go. The fact that there maybe aren't refresher courses, and most are looking at, because most accidents are usually as a result of PSVs, colliding with other PSVs, other trucks, and also personal vehicles. The fact that there aren't refresher courses as often that are required, do you think that would also be a problem leading to such poor behavioral and decision-making processes on the road? Yes,
you're right that the aspect to do with the training, testing and licensing of drivers is largely behavioral in nature, because it involves improving your capacity as a driver to ride or drive. Now, NTSA, working with partners in the recent past, have come up with a national curriculum for training of different categories of drivers, right from riders all the way to the bigger vehicles, the 22-wheelers and above. So that has been that is something which has not been there before. For a very long time, different driving schools use different standards of curriculum material to train their drivers. But we do have a current law which has just come and it's been gazetted in the recent past, early this year, and it has come into force. The whole idea, one, is to work towards the whole chain of driver training, testing and licensing. So the first thing we've done is
allow me to just interject at that point before you delve deeper into just helping us better understand this whole concept. We are supposed to take a very quick commercial break. We'll be right back with more of this discussion. If you have any questions in regards to how, training when it comes to driving courses are done here, the curriculum, that is what we are about to delve into. But first, let's take this break. We'll be right back with more of this particular discussion. Do stay with us.